Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. It's estimated that about 30% of people with depression are diagnosed with treatment-resistant depression. Treatment-resistant depression is debilitating, and patients don't see improvement through medication or antidepressant therapy. But that doesn't mean there is no hope for treating this kind of depression. Today, we're talking about a non-invasive treatment option for depression, transcranial magnetic stimulation, or TMS, with Dr. Umer Najib, Director of the Transcranial Magnetic Stimulation Program at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Najib, to Tuesday Talks.
Thank you, Mary, and thank you for having me here.
Well, it's good to have you here. If you have any TMS-related questions, just submit them in the comments section below, and we'll try to answer them live. Okay, transcranial magnetic stimulation, that's a mouthful, or TMS. So can you tell us exactly what that is?
TMS is a non-invasive neuromodulation treatment. So let's look at the name, transcranial. So as the name suggests, it's across the skull or across cranium, and magnetic stimulation, meaning stimulation of the brain using magnetic pulses. The TMS device or the equipment has a part that comes in close contact with a patient's skull and generates magnetic pulses. These magnetic pulses, they cross the skull or go across the skull and stimulate the neurons or the brain cells. They activate the brain cells. There are several different ways of using this magnetic stimulation, and one of these techniques is called repetitive TMS or RTMS. What that essentially means is that there are volleys of pulses at certain frequencies that are delivered to the brain, and the result is that the target brain area or neurons or brain cells, their activity either increases or decreases. So TMS, using TMS, we can target with great accuracy a particular area of the brain, and we can either increase the activity of that target area or decrease the activity of that target area.
So both will help with depression. I guess in some people they need increased activity and some people need decreased activity?
So in depression, it's used in one particular way,
okay.
and we'll talk more about that. But this ability of TMS to on-demand either turn on the target brain area or turn off can be used in multiple different conditions or diseases
Wow.
with different goals.
Okay. Now, this is an FDA-approved option for managing depression. Can you tell us exactly what we could expect? You know, how exactly does it work? I know it's outpatient, right?
Correct. So this will help me segue into how exactly does the TMS work for patients with depression.
Yeah.
As you mentioned, that this is an FDA-approved treatment option for patients with depression. Now, imaging studies have shown that in patients with depression, there are certain parts of the brain, certain areas of the brain that are less active as compared to people who do not have depression.
Oh, okay.
And by using TMS, we target one of those areas that is in the frontal lobe or the anterior part of the brain on the left side. And as I said, using a certain type of TMS or certain parameters, we turn on the activity or increase the activity of that area that has shown to be hypoactive or less active in patients with depression. Now that particular area is connected, it's part of a network of different regions of the brain that are involved in depression, and increasing the activity of one of those nodes of the network results in an increased activity of the other areas as well. So that is how, think of it as a gateway into the whole network of regions or areas of the brain that are involved in in depression and increasing their activity.
So it sounds like you're waking up that part of the brain that needs to, for lack of a better word, fend off depression?
Correct. So that's exactly what's going on. Imaging studies such as functional MRIs or PET scans show that the metabolic activity, the neuronal activity in those regions is less than in patients or people who do not have depression, and that's the basis of a lot of pharmacological treatments as well.
Sure.
But pharmacological treatments cause changes that are across the whole brain and not focused in those particular
On
areas.
that one area. Yeah.
Using TMS, we can just target the area that's involved and either turn it up or turn it down, depending on the underlying problem. And in patients with depression, that area needs to be increased or turned up. And that's how we use TMS to treat the patients with depression.
And how do you actually distribute or do the TMS? Because if I remember correctly, because I think I saw this one time, it's like a wand that you're waving over that part of the.
So part of the device, it's called the coil, or it's a figure of 8 shaped part of the device that comes in contact with the skull.
Okay.
And the magnetic pulses are generated in the center of that part. It needs to be in close contact, in good contact with the skull for the magnetic pulses to go through the skull and reach the brain. And that's how it's done. When patients come in, after we've taken necessary precautions for the treatment, that part of the device called the coil, it's placed in contact at the appropriate treatment location, and these stimulations are provided.
No incisions.
Correct. Completely non-invasive.
Ah, that's my kind of treatment. I like non-invasive. That's always good. So how long is a typical TMS session for depression?
The typical TMS treatment session is about 40 to 45 minutes long.
Okay.
However, the first treatment session is a bit longer because that requires for us to determine the exact treatment parameters for the given patient. So here's another great thing about this treatment, that it is highly personalized. It's individualized therapy. So at the time of the first visit, we determine the exact intensity or the strength of the magnetic pulses that we need to get to that particular patient's brain, and then the target area, depending on the anatomy, that may be different for different patients. So we determine where the treatment location or the target area is, and this takes a bit longer. So the total duration for the first visit is about an hour and a half.
Okay.
All the subsequent visits are 40 to 45 minutes long.
And how many sessions are needed for treatment typically?
So typically, 20 to 30 treatment sessions are needed to see benefit or to cause the change, the desired change that we're looking for. So the standard of therapy is 30 visits. These are Monday through Friday for about 6 weeks, so 30 treatments in total.
Okay,
It's
so
a daily treatment.
It's a daily.
It's a daily
okay,
treatment.
That was my
Patients
next question.
have to come in every day. It's a daily treatment for 30 visits.
And how long till typically a patient will see or feel a difference, in the effectiveness of the treatment?
The effectiveness of the treatment can last for several months. Now, patients who respond or who get better, about 1/3 of those patients achieve complete remission. This is based on some of the clinical studies that have been done in patients with depression. And for the others who do not achieve remission, the benefit tends to last for several months. But most of those patients require some sort of maintenance therapy.
Okay.
Either a lesser number of treatments, once a week, twice a week, ongoing, or a few days of treatment every few months. So again, this is very individualized therapy depending on a patient's response, depending on other factors, their other healthcare needs, their job, how far they live from the hospital. So this allows us to tailor the treatment specifically for a given patient.
For them. So do you see even like a little bit of a difference after like the first couple of treatments in some patients, or does this have to be built up?
It has to be built up.
Okay.
Typically, patients start to notice, or even in general, when TMS is done like this, it typically takes several treatments to start to notice a meaningful change.
Yeah.
Now, patients may have a very short-lasting change after one treatment or two treatments, but in order for it to be meaningful, lasting hours or lasting days, they have to have multiple treatments. And we typically start to see that after 2 to 3 weeks of therapy. So, in other words, 10 to 15 successive treatments is when we start to see a change that's lasting for days.
So some patients, there are some patients that when they complete the 6 weeks of treatment, won't need any more treatment after that. But some will, and it's just varies by patient.
Correct.
Still very cool. So what would you say are the main benefits of TMS?
I would say that there are a couple of important things or major things. One is that it's a non-pharmacological treatment. So the potential side effects that are seen with antidepressant therapies, such as gastrointestinal side effects or sometimes rare cardiac side effects, other potential side effects. With TMS, patients don't experience those typical medication side effects. And the other major benefit is that it's very focused. It's focused on the regions that are involved in this problem and spares all the other brain regions. For instance, again, an antidepressant therapy will affect the whole brain, and sometimes that can result in problems with focus or cognitive side effects or sedation and so on. With TMS, it's again focused on an area that is involved and does not affect the other regions of the brain.
It's very targeted. You're just fixing the area of the brain that needs fixing.
Absolutely.
Okay, good to know. Are there any side effects with TMS?
So the most common side effect is the discomfort on the scalp.
Okay.
And possibly a headache after the treatment. When the magnetic pulse goes across the skull, it feels like a tap on the head.
Oh, wow.
Now, the strength of that tap would be different across patients. The main determinant of how strong the pulse is needed to get to someone's brain depends on the thickness of the skull.
The skull.
So the thicker the skull, the higher the strength of the pulse that's needed to get to the brain. So if someone has, in a patient where we need a really high strength of the magnetic pulse, the higher the strength, the more uncomfortable that tap would be on the head.
Sure.
So that's the most common side effects that the patients report. But it's extremely rare where it's uncomfortable enough for them to not be able to continue therapy.
Sure.
In almost all patients, it's not bad, too bad.
Benefits outweigh the short-term pain there.
Now, I would add a couple of rare side effects that can be seen with this treatment are some neck strain, ringing in the ears because of the equipment on the head and the devices. We obviously take precautions to prevent those problems. So, an extremely rare side effect that the patients need to know about is that it's stimulation of the brain. It stimulates the brain. And an extremely rare side effect is that it can potentially cause a seizure. Now, this occurs in 1 in several thousand treatments.
Okay.
And it's an extremely rare. And we obviously, again, we select the patients carefully to prevent this from occurring.
Okay. So who is a good candidate for TMS?
So a good candidate would be a patient with depression who has failed medical management, medical therapy, and at least 2 medications,
Okay.
who does not have a history of seizures,
Right.
who does not have a history of brain trauma, brain hemorrhage or bleeding inside the brain, or stroke, and who does not have any hardware or implanted device in the head and the
In the
neck
head.
region, just
Okay.
because of the nature of this magnetic stimulation, and we don't want any interference.
What about a
with that.
concussion? Is that considered trauma?
If the concussion did not lead to any injury that was seen on scans, then that is not a contraindication, and patients can get this therapy.
Okay. Now, this is the one that everybody wants to know. Will my insurance company cover TMS?
So the good news is that most of the insurance companies do cover TMS.
Great.
Their criteria for coverage may be different, and this is for, as you mentioned earlier, treatment-resistant depression. So
Yeah.
what that means is patients who have failed medication therapy or antidepressant medications. And the requirements for different insurance companies vary. Some cover it for patients who have failed 2 antidepressant medications, whereas some cover it for patients who have failed 4 antidepressant medications. So it ranges between 2 and 4 antidepressant therapies, but most of the insurance companies do cover
Do
this.
cover it. Good. And what is the success rate for TMS, for depression?
The clinical trials that looked at patients who had treatment-resistant depression, meaning who had failed medical therapy, those clinical trials showed that TMS was beneficial in up to 60% of those patients. So
Wow.
almost 6 out of 10 patients. And this benefit was defined as a clinically meaningful improvement in their mood. And out of the patients who got better, as I mentioned earlier, about 1/3 of the patients in some of the clinical trials achieved remission.
Oh, wow.
They did not require any further therapy, whereas the other 2/3 required some sort of maintenance therapy, but had benefit lasting for months.
Wow, that's great. Now, can TMS be used to treat other conditions? I know it's not just used for depression. What other conditions are we using TMS to treat now?
One of the other conditions that was recently approved by FDA is obsessive compulsive disorder.
Oh, OCD.
So OCD. TMS is now covered for the treatment of OCD. And here at the Rockefeller Neuroscience Institute, we are in the process of setting up a clinic for that, for
wow.
TMS. There are only a few specific devices, equipments that are covered for that particular treatment.
Okay.
And our plan is to complete the setup over the next 6 months, and I'm optimistic that by the end of the year we'll be able to offer TMS for OCD treatment as well. In addition to that, TMS is useful being used at the Rockefeller Neuroscience Institute as an off-label treatment for certain other medical problems such as chronic pain and stroke recovery.
Oh, wow, great. So there's a lot of different ways you could use this, huh? All right, but what would you say then, getting back to TMS for depression, for the people that are watching, what's the most important thing you want our viewers to know about TMS for depression?
What I would want the viewers to know is that TMS is a non-pharmacological, non-invasive treatment option for depression that can help in up to 6 out of 10 patients who receive this treatment. A patient with depression who has failed at least 2 antidepressant medications may qualify for this treatment and should talk to their provider about exploring this option. This information is also available on the Rockefeller Neuroscience Institute website.
Mm-hmm.
And if a patient at home Googles RNI TMS, they'll be taken to a page that contains all this information and also allows the option to request a consultation for the use of TMS for depression.
And is the Rockefeller Neuroscience Institute currently the only ones in the state offering TMS for depression that you know of?
There are, As far as I know, there are a couple of private practices that offer this treatment as well. But Rockefeller Neuroscience Institute obviously has a comprehensive multidisciplinary TMS program where our behavioral medicine specialists who specialize in treatment-resistant depression evaluate these patients and create a comprehensive treatment plan for them. We are neurologists like myself are involved in the program and make sure that it's safe for the patients and it's done in an optimal way where the treatment is actually getting to the brain.
Yeah.
And where this is the only location in our state that is able to offer TMS for off-label use, such as stroke recovery, chronic pain, and offers more advanced use of this technology.
And you don't have to leave the state to get this kind of treatment. It's right here.
Absolutely. We are one of the few handful centers in the country at this point that offer this for some of these other off-label uses. Just because of our expertise, we have the expertise and the infrastructure to offer this to the patients of our state.
All right. Well, thank you so much for sharing this information. It's really interesting. I mean, you guys are always doing interesting things over there. And this sounds like a really good option for treatment of depression.
Absolutely. Thank you so much for having me here, Mary.
We're glad to have you. So that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about TMS for depression, visit wvuMedicine.org/TMS. I'm Mary Ravazio Menard, and on behalf of Dr. Najib and everyone at WVU Medicine, thanks for joining us and have a great day.